an ideal world, we would have the resources to be able to provide everything to everybody, everywhere, all the time. And in traveling around the world and recognizing some of these disparities, you can go sort of down one of two paths. One is saying, well, I'll never be able to make a dent or a difference because that delta is too big and the gap is too wide. Or you could make an effort and try to narrow portions of that gap.
Village Healthworks has this holistic approach. It's a whole system. And what is happening there is not just for that hospital, it's for regional community all over Burundi and beyond. And this is why our goal is really to become a center of excellence, a regional hub in medical care and help to change the healthcare system in the region.
On the drive-in, you see an incredible, diverse group of people under difficult circumstances. And so you'll see children who are working in palm oil, multiple people who are commuting on motorbikes where they have, 4 to 5 people, no helmets, rough roads, lots of exposure to hazards. And then you come up into the hills and you see this incredibly beautiful compound. On a physical plant scale, that hospital is comparable in many ways to what we have in the US, and that is inspiring.
Our patients' needs are critical in orthopedics. All hospitals in Burundi, they don't have any tools for the fixation, for the treatment of the bone, and also there are no diagnostic tools. For example, there are no CT scans around, there are no MRIs around.
The consequences are often amputation and profound disability.
I know a lot of people who are disabled because they didn't have access to orthopedic surgery, and what a burden it has been for the family and the community.
That person can no longer be mobile. They can't provide for themselves or their family. They have no prospects of being able to work in an agriculturally based society. The caring, compassion, and training, the expertise of the physicians and surgeons at Village Healthworks is incredibly high, but the resources are still very challenged. And so I think what we have in Kigutu is the opportunity to provide a path by which orthopedic surgical companies can take this equipment, take these materials, and make sure that it is going directly to patient care to have impact.
I know this is going to make a huge, huge difference. And I know we are going to, as a result of that, have a healthier community that can become more productive.